Hello, this video is going to go through how to create an intake or a diagnostic assessment within the electronic health record. So after you've seen a patient for the first time, you'll want to add the, the intake in the ledger. And after that, you're going to be inserting your intake. So to access the electronic health record, you're going to go to exam up on the top. Right now, I just have pulled up a patient. This mystery patient within our system does not have an intake currently in there, so you'll be able to see exactly what it looks like when we add that first document. So I'm going to go into exam. So as you can see here, there's nothing in here. So it's a blank screen and it's asking you to hit the plus on the top to add a new document. So this is the plus up here. This is where you would go to add any document. And you can see that all of these, most of these are you can't click because there's nothing in this record right now. So for mystery patient, we're going to add the intake. You're going to click the add, and there's a couple options. So this mental health intake was a document that was created for our agency. It was created quite a while ago, so there is one, I think the only tab that's different is the mental health status tab, which has a few more options in it for different things you can select for the mental status of that patient. The other option is the mental health intake down here, which is a CompuLink owned document. This one is updated on a regular basis. So right now, if you use the mental health intake up here, it will say that the format is not updated. You can still use that, just bypass that box that comes up, or you can go to the mental health intake that's owned by CompuLink. So either one will work. It's essentially the same. The only difference is the mental health status. She is just got a few less things in this one that's CompuLink owned. However, this one still gives a very good overview in the mental health status. So I'm going to click this one, the mental health intake that's created by CompuLink, just so you can kind of see what that looks like. And like I said, it's totally up to you which one you use. This one you'll just have to bypass that it is not formatted in the updated version. There is some kind of weird formatting things that may show up where things aren't lining up correctly, and things are overlaid because it hasn't been updated, just so you're aware that that may happen. So that's why I've been using this one instead. So then just double click it and it'll start your mental health intake. So there's different tabs up on the top that will be completed. So your exam date, so this will just generate to the date you're entering the record. So this, if I actually saw this person a while ago, let's say I actually saw them on the 21st, I can go in here and change this so it's the correct date. So just be aware that you will have to make sure that that date is correct for the date that you completed the intake for that patient, because it will auto generate to the day you're entering the record. Then the first thing you do is I usually start on this side and go over. You can do it however you want. However, just you want to make sure you go through each one of these tabs as you're filling out the intake. So the complaint is your first initial one. I'll just give you some general overview of kind of some of the boxes and how to enter these. So for presenting problem, you'll want to put the type of visit, which this is a diagnostic evaluation, so it's because it's your initial intake. If it was in the office or how it was done, if it was by telehealth, you can put that as well. Generally, it's going to be office, however. If it was virtual, let's say it was telehealth, there does give you the options to say what type of telehealth. Was it just by phone? Was it audio and video? So that is an option. You don't have to fill that out, but that is an option. If they were accompanied by someone, you can indicate that in the relationship to the patient. And again, so this one you would just have to type in. This one has a drop down, which you can indicate what that relationship to the person accompanying is. Generally, I'm not filling out this information. This would be if you get a referral from somebody for that, you definitely can. However, it's not generally something that is necessary. Then the next is the complaint history, which is the reason that they're coming in to see you. So what is the presenting problems? So there's, whenever you just hover over these three, it'll give you the options. This is the first time that you're entering something, however, so you're not going to be able to edit or forward from a time before. So you're going to simply go to add, and then it's going to give you a box up here. This box has very limited characters, and then there's a couple of options of how to do this. So let's say this person is coming in for presentation of anxiety symptoms. So if I put anxiety, and I can put more information in there too as well, but I just want you to see this box over here is going to be what shows up in a narrative box. So when I click enter, you'll see this patient's not set up with the age. Um, however, it would say the age of that client complains of anxiety. So you can, and you can see I'll put it in a sentence format. You can also indicate, and some of these do have drop downs. So like for instance, onset, it's been happening. I don't know, we can just check that it's been chronic, and it'll add in the onset is chronic. Duration, we can just put years, and it's going to add to that sentence 4 years. And it shouldn't have these spaces in there. It shouldn't auto-generate to that. It should be a full sentence. And then you could say if that progression is worsening, you can click that, and you'll see, as you can see, it just continues to add different sentences. So you don't have to fill up sentences. The other option is you can type over in here too. So let's say you wanted to add additional information. Let's say you wanted to add more details to this. For instance, maybe it's something after a specific event. You could put if I can spell. There we go. And it will show up that way. So you have options to either put things in here and have it auto-generate, or you can also just type in here, or you can auto-generate and fill in as needed. And again, there's lots of other options. And on some of these, like stressors, I just double-clicked. It does have some things you can select and hit OK. So that is another way. Same thing with factors, any relieving factors. So there is some of them where in these that don't have the drop down that you can double click for additional information over here as well. So once you're done with that, you just simply hit save. You can do save plus if you have more than one complaint. You can have 2 in there. And that's where you would use this plus. So if I hit save, it now will show that this is what I entered and the information is entered in here. Our next is the diagnosis. So as you can see, there's nothing here. So we're going to hover over the 3 dots and we're going to add a diagnosis. And again, we can't forward because there's nothing to forward. And just so you know, if you enter something that is incorrect, you can go back in and delete it as well. So then you have the diagnosis box that comes up. In this, there's a couple ways to add it. If you know the code, you definitely can go that way and find it. The other way is there's a drop down, you can find it that way. However, some of the most popular ones will show up when you first hit the drop down. The other way to do this as well is to just put the first word. Like if we were going to do generalized anxiety, if I put generalized and hit the down arrow, it'll bring up anything that starts with generalized or has the word generalized in it. And then it's right there. And so then I can double click on it. There you can change severity. You can select severity. And there is some drop downs for how it's changing, if it's worsening. And then for any diagnosis that do have anything that is specified, you can type that in here as well. And the code will automatically populate once you put that description in there. Once you have the description up here, this part right down here is a nice tool for showing how they meet that qualification for a diagnosis. If you double click on the assessment, underneath assessment, it doesn't look like there's a box there, but there is a box there. If you double click it, oh, now it's not gonna, oh, there we go. It's delayed. So it will bring you up, these are all the different factors of how they qualify for that diagnosis. So you can go through each one and identify how they meet that diagnostic criteria. So it's maybe for this person, it's occurring most days, admits difficulty to control worry, associated with difficulty with concentration, fatigue, irritability. You get the point. And then it's not due to any medical condition, substance abuse. So this just puts in a statement that they do have generalized anxiety disorder. So then once I have these clicked, I can hit OK, and it puts it in here as a narrative of how they fit that diagnosis. And then under plan, you can do the same thing. You can double click and you can select any of these as far as what's your plan to help treat that diagnosis. So we're going to do some sessions. Maybe we'll work on coping skills. There's lots of different options. And then just hit OK. And then it'll bring you up what that plan is for treating that diagnosis. And then once you're done, you can go here to add another diagnosis, or you can just simply hit save. This Smart Patients order will pop up. This is not something you have to do. It's just an easier way to access some of the information. So for instance, these would be those plans that you entered into the box. If you missed a part, it's just another way to get into that. Usually I just hit cancel on this because it's essentially the same thing. So now you can see I have my diagnosis. This is how they qualify for that diagnosis and the plan for treating them. So now we have completed everything on here. So the next box is the psychiatric history. So in this box, there's different categories that you can fill out. You fill out what in your intake, kind of what is necessary. So if there's no history, one option is just selecting no significant history. And then it'll show up that it was assessed. If there was, however, usually some practitioners want to do more of a narrative way of like showing that they have how they assessed it. There's a couple options you can add here to the psychiatric history or add any treatment history. The other way is anytime you see these 9 dots, what that means is there's a checklist. So you can do it in a checklist format. So I'm just going to show you that. I'm not going to use that one to enter information, but I'm going to show you what it looks like. So then it brings you, okay, what's the diagnostic history? So we can say, yep, there's ADHD, history of anxiety, whatever that may be. And then if you hit save, it'll add it in there. But then what you need to do is go in and add narrative boxes. Some people do like doing that. Whoops, sorry. I don't generally do that just because it's just a few more clicks. I find it's easier just to hit the add psychiatric, which then gives you this narrative box. Is there psychiatric history? Yes. Or you can hit no. If there's high risk, you can put a description here. However, that's not necessary if you don't want to. And then I generally just simply put, this is the psychiatric history there is, and then put a narrative box in here. And then what I will do is then I will type out what is that psychiatric history, and putting that in narrative form. I'm just gonna type random letters just so you can see kind of what it looks like. So then you can see it's here, and then it'll show part of what was typed in that note. If it's long, it's just going to cut off, but then you'll know you can just double click it and go back in to see all the information. When it prints out, it's going to print out in section. These are going to print out in sections, and they'll be in nice paragraph forms. And then if there's any family psychiatric treatment and history, that's the same thing. You can do the check boxes. I'm going to do the check boxes just so you can see. Let's say in this family there's history of ADHD, anxiety, bipolar, and then I hit save. Then it's going to have these 3 are going to populate. So then you can put, you know, was there any treatment? What were they treated with? Did they do therapy? Did they not? Maybe they did some cognitive behavioral therapy or no therapy. If I do that, it just keeps, all that's going to show up is this information, and there's no additional information. So then what you'd have to do is go into each one and write that, what that ADHD history is for that family, for instance, and put that in narrative form, just so you can see kind of how that ends up looking. Again, this is the anxiety one, so you can put information of what family member has anxiety. Same thing with no treatment. You can identify who had no treatment. And then same thing for homicide and suicide history. You can do the check boxes again, and that's what this is going to look like. Or you can simply add, let's say there is some suicidal history. You can do that, yes. Or if there's none, you can just simply go to this one and just hit no and save, which would show that it's been assessed. This is trauma and abuse history. Again, there is a drop down where you can access some of that and then add details later. Or you can go in and add, yes, there's trauma history. And then add information. So that is the information in the psychiatric history tab. Then we have personal history. So in this one, all of these, there's there's actually 3 ways to enter this information in all of these categories. And some of these, mind you, may not be appropriate. Obviously, if you're seeing maybe a small child, you may not be doing a gambling history. And you can just bypass that part or just select it and hit no or not applicable, whatever. So this one covers behavior, educational, housing, and vocation. So again, we can do the check boxes here, and it's going to bring these different options. It's not going to be inclusive, so there might be things that do not fit. The other option is to go over here. So for this one, you could go to behavior, and it's going to bring up all these. And then again, you can select and then add details later. And you can see there's no detailed note that shows up because those are something that you'll have to add. Disability, if there's any disabilities. Education, there's some things you can pre-select if they're, instance, maybe they're a high school graduate, some college. Financial, those would be some options. Housing, what are their living arrangements? And this one just simply says living arrangements, and then you can add in the more information. And then military, if there's any military information. The other way to add these, then again, just like I said before, is just hit the add. And you can hit this down arrow, and there's lots of different titles to this narrative box that you can change. So maybe this is just the behavior history, so you're going to do that. But maybe later I'm going to add in the education history, and then if I can just select that, and then I can have my narrative there. Another way to do this as a shortcut is sometimes if you're wanting just to do it into one paragraph, is just indicate as if you're doing an overview of the person's behavior, and then maybe you want to go into education, you can just simply put like that in titles and do it that way too. And then you'll see that it's there. Whatever you typed is going to show up. So then you have that in there. Sexual behavior is going to be the same thing. You can add it's just a general narrative box, or you can select the auto select of different options. Again, not everything is going to be there, but you do have the narrative box if it's not. Gambling, just click this so you can see what pops up. Physical, this would be a physical health. And in physical, though, we do have the option over here too of some drop downs as well. There's the nutrition. There's a couple of pre-selects so you can add daily notes or add detailed notes. There's pain. If there's a history of pain, there's a few options. There's women's health, more specific to women in general, and then men's health, some more specific things. And again, the other option is to simply go to the ad and just do an overall summary of nutrition. There is something to keep in mind. I mean, this is going into some health stuff. Some of that may be put in a different area. So it's really up to you. Like maybe there's something in here as far as like health wise that you want to also put into a different, maybe it already was covered in a different area. You don't have to put it in twice. Sometimes some of these overlap a little bit. And then same thing with personal safety. There is some auto selected areas for not much, but if there is any safety concerns, that is an option as well. And again, you can also put the ad and do a narrative box instead. If there's a crisis safety plan, that can be added, where you can actually add a safety plan if that's something that you've done. And as you can see, this is kind of what it would look like. So you'd have kind of what are your coping strategies, people they can call, and then also phone numbers and emergency numbers. Legal, and again, there's drop down. If any legal issues that could be selected, or you can simply just hit the ad and do a narrative box and do a summary. I should mention too, like this is here for if you want to be more specific as when this issue began and when it started, when it ended. I mean, these are all options, but they definitely don't have to be done. But that is there if it's something that you want to use. And then our next tab is family. So I'm just going to show you a couple ways. Down here is the narrative box. So you can type in here your narrative, a summary of family. The other option is there is a way where we'll auto generate into a paragraph form, where if you put family member's name in here, so if like, for instance, maybe we're going to have Sally is the mother relationship. You can put that in there as well. This is relationship to and relationship with. And then you can also put a note in here, anything about like the relationship. This is not like the cleanest way to do it, but I just want to give you just a general idea. And up here, you can forward from last, but again, with this is your intake, that's not going to be an option. I'm just going to put some of this stuff just so you can see. And if I put here compile family dynamic information entered, what it's going to do is compile anything that I entered up here and put it in a paragraph form. So at least puts the information in. You might have to clean it up, but that is a way to generate into here, or you can simply just type, and then you can put family information in there, any relationship information, anything you want about the family unit in itself and that history that you've gathered. And then we're on to the medication tab. This is where you could add any of those medications, allergies, or medical alerts that you have for that patient. So if they are on no medications, you can simply click the no medications and it's going to put none reported. If they do, now let's say, okay, that was by accident, you can definitely delete this. Just go to delete and it'll take it out of here. Maybe, now it's not going to work. If you want to add, you can simply put the medication name, dosage, and any detail, prescriber, anything that you want to put in there for any medications that they are. So that's how you would add medications. And then same thing with like allergies, we can add right here. If there's any alerts, you can add. If you want to alert anybody on anything specific in medical regarding medication or medical any high risk stuff. There is some additional kind of tools up here. I will say, like, so this is assessment tools. So this is also in a different area as well, that I will go over in a different section because this also shows up on a different tab. There's review of systems. So there's this that can also be added that talks about if you're reviewing kind of history of different episodes. That is an option, and it'll show up over here if you do add that. Go back to the medication tab. If there's health history, that can be added as well. If there's any past medical, which again, you can do the select boxes, or you can do just the adding, of a text box with the information. Family medical information, surgical history, tobacco use, social. So again, it's going to give you, all of these are going to have different things you can select. And then, or else you can add. So this is an additional health history, which tab now that generated because in the medications tab, I hit this additional health history. And there's also one for addictions as well. And you can do the CAGE questionnaire in here as well and calculate the score. So now we've gone through the and you can see now that I did added these 3 things, there's additional tabs that were added into the intake. So now we're going to go into the mental status. So this is the mental status page. If you use the intake format that was created for our agency, this is going to look a little bit different. There's more options right here. And then the risk assessment is also there. It's just over on the side. So it's just formatted a little different. But there's way more of these different headings and options. So this is just going to give you, whoops, I'm clicking on things, sorry. This will just give you the general basics. So the easiest thing to tell you when you're doing the mental health assessment is up here, where up in the title where it says mental health assessment in the 3 dots. If you hover over that, you'll get the thumbs up icon that says assign normal values to the tabs. This is the fastest way to adding. You can also kind of set favorites, but that takes a little bit of time, or you can forward if you did have a previous document, but again, we don't because this is the first one we entered. So I'm going to click this assign normal value to tab. So when I do that, you'll see everything has been auto-filled to normal. If they presented normal, You won't even have to change any of these, or maybe there was something that was a little off, maybe that you want to change. Like most things were normal, but there was a couple things you wanted to identify that was not. So for instance, like affect, right now it's normal, but at any of these, you can hit the drop down arrow and it'll bring you all the options. So maybe their affect wasn't normal. Maybe they had a flat affect. So you can change that and it'll change that one. Maybe their mood was maybe a little more, maybe lack of feeling. I mean, there's all kinds of things in here, as you can see. I mean, so you can just kind of click, maybe it was, I mean, you can, whatever, just click a couple. And then you can see if there's more than one, what it's going to do is just going to put it in like that. And then under risk assessment, to show that you've assessed what is their suicide risk, what is that risk for child abuse, elder abuse, violence, partner abuse, and relapse. So you can go here to hover to the 3 dots and hit assign normal values, and it'll put none if there's none risk, and if there's no risk in any of those areas, and let's maybe say there was, you definitely can go in and change. Maybe this one's moderate, and this one you'll see there is this right here that you can hit. Some of them have that. This one doesn't have anything preset, but obviously you're going to have some of this stuff in other tabs as well. So like for instance, under suicide, maybe you already there was a previous tab under like personal safety. If there was a crisis safety plan, some of that might already be in there. So, I mean, it's up to you and where you want to put that. But you definitely can put it in this mental health status as well. And then if you wanted to say more about that, it's simply just writing something in the narrative box of why you're assessing that as moderate risk or high risk, whichever one you selected. So that's the mental status tab. Then we're on to the therapy tab. So in this one, there's a few different things that I just want to note out. That up here is the different type of progress notes that you can add. For an intake, you won't be adding them. I mean, you sure can, but it's not necessary. If you were adding a therapy note to this, this is how we did it. And I'll go over that in the video that goes through the progress notes, so then you can see how that is done. If you want to add, there's another option to, so this is if you want to clear things, but I'm just going to go through a couple of these. This is for interactive complexity. If you're billing for interactive complexity, simply checking this will put information into your intake that interactive complexity was present. So this psychiatric review of services, there's different things in here, so you can go into some of these and it'll bring up different boxes and put additional information. So that is, and again, this is another one that'll add additional information. And then you can, so let me do that again. So this is to go back. So that's if you were doing something, you can go back and do more. So now I'm going to go back to the plan tab the therapy tab, I mean. So this is where I just hit the psych, the review of services. So that can be done, doesn't necessarily have to be done. Another option, which doesn't necessarily have to be, is if you're going to use any assessment tools. I am going to add an assessment tool in here as well. Just so you can kind of see what it looks like. So in PsychAdvantage, there's presets of all of these different assessment tools and screenings that are already within the system. So for instance, like I know some people will use like the GAD-7 for anxiety. There is also the Vanderbilt screening rating scales are in here as well, or some depression screenings, suicide risk screenings. cage. There's a number of different ones that are in here. Honestly, I haven't gone through all of these, but I'm just going to show you. So let's say, obviously, this person came in for anxiety, so we did the GAD-7 just to see what severity of anxiety that they're experiencing, and it'll give you the questionnaires. So and again, it adds the tab to it. So now we have this in here added as an addition to our intake. So then I can just simply have them answer these questions. Now, again, this is something you can do during your intake as well. So you can add this document and not finish it, and have them just answer the questions. Or you could have these, if you have those tools, you can have them printed as well and then just add it later. So it's totally up to you. So let's say I had them fill this out, and I'm just going to add in some scores just so you can kind of see. Oops. So once I have the score, this is how they answered it. I can print the report when I'm done to have that if I really wanted to, or if you wanted to give it to them. Then to calculate it of what severity they are, I just hit calculate and add to assessment, and it's going to calculate it. And now it's complete. So now when I go back to my therapy tab, you'll see under psychological assessments, it's there. And if I click it, it's just going to say go back to that layout. So it's going to go referring here. When you print this, however, if you've added assessment, it does show up when you're printing the document, and it will kind of do a summary of the assessment completed and what the score is. So now we're going to add, so in this box, really the only thing that you're going to be doing in an intake is if you're adding any of these additional things. Then our next step is adding our goal. So what's our goal for treatment for this person? Again, we can do multiple goals, or we can add a simple goal. So in multiple, it'll give you some general ones that you can possibly select. The ones that CompuLink has identified, in my opinion, are not the greatest. So I usually just go to the ad. So when I go into the ad, there's a couple things. Again, this is a narrative box, similar to the complaint tab where things kind of generated. However, it's a little bit different because things aren't going to carry over. So I have a drop down, sorry. So this is where I have my short-term description for what is the goal. So as you can see, there's lots of them already pre-built in here. You can definitely go through and find something, or you can create your own. There's unfortunately not a way to like search through here, and everything's kind of in alphabetical order, but it's kind of all over the place. So you just have to do your best. Let's see. So I'm going to just simply add. So maybe our short-term goal for this one is manage anxiety symptoms. I don't know. I'm just going to put something crazy. It's just simple, just so you can see. And then you can link the diagnosis to that goal and identifies as a primary goal, secondary goal, because you might have different types of goals in there, because sometimes you have more than one goal. What's the frequency? There's different options there. Again, you don't have to enter that. If there's a target of when you're going to have that goal achieved, and again, you don't have to put those targets in there. So I'm just going to select something just so you can see. And then these again are optional, different things you can put, percent achieved. You're not going to have any of this right now because it's the first one, but some of this will carry over into the treatment plan, which I'll show you in the treatment plan video later on in the series of videos. So then you can simply put a longer description of your goal. So maybe it's patient will develop, or here we'll just put demonstrate utilization of coping strategies to manage anxiety, and you can add additional information. I just want to show you. And then under treatment objectives, you can double click in this area and it'll give you a number of different types of services that you're going to provide. So maybe for this person, well, we're doing a diagnostic evaluation, but we're also going to, you see there's lots of different options. Be doing some psychotherapy, maybe we're going to do some, yeah, there's all kinds of things. There's also telehealth options too, if you're seeing them, telehealth at the bottom. But you can see there's all kinds of different options. So then once I hit OK, it's going to carry over a list of what we're going to be doing to accomplish this goal. Then I simply hit save. I could have put the add save plus to add additional goal if you have an additional goal. So right now you can see this is my goal. Now I'm going to, and you can see the short term shows up here, or that quick description, and the longer description is down here. Then we're going to add objectives to our goal that we identified. To do that, you can do a multi-connect. So this is when it says multi-connect goal, so whatever we have highlighted up here, because you might have two goals. So whichever one you've highlighted, if you click this, it's going to add steps to that goal. And only the highlighted one. So if you click that, it's going to give you different options. So you can click whatever objectives you feel are going to fit for the goal that you've identified. They're doing groups. Maybe I'm going to have them identify history of feelings, negative thought patterns, triggers. These are the only options right here. So the next thing is so you can see, obviously that doesn't cover everything. So the other ways to add more goals is to simply click the add connecting to the highlighted goal. So again, I'm going to make sure that's highlighted, hit that one. Maybe my next step is going to be identify coping strategies. And again, you can add additional information if you want. And then it just adds it simply to the list. So now you can see I have 3 things there, or 4 things. So then, and then the bottom is your discharge criteria. So this is a box where you can just type. So you can type in what is the criteria for discharge. And again, this is a narrative box for strengths. There is some different things that you can select as well if you would like to do that. Needs, same thing. All these things do have auto selects if you desire to add them in. Abilities, again, preferences, urgent needs, anything of that can be added. Then our last tab is the plan. So our diagnosis should have auto-generated from the complaint tab. So earlier, the very first tab, we added the diagnosis, which will carry over. So you want to make sure that's present. And then you'll see the assessment we put in there, the plan we put in there is already there. I selected that interactive complexity on the tab in the therapy tab, which followed over. You can add additional education information if there's additional stuff that you have to add in there. Any treatment refusal, there's a narrative box for that you can add. Next appointments, you can add in here what that plan is. You know, maybe they're kind of come in for therapy, and you can write information on there for scheduling and what your next steps are for this patient. Once you're completely done, and again, so this is any images, so this can be any documents that you want to attach to this document, to the diagnostic assessment or the intake, you can put them in here by simply adding. Just hit that add and it'll allow you to add documents. And then these are those tabs that we added within the record. So now We have everything completed. The last step, once we have everything completed in there, is signing off. So we're going to simply click sign off. And it's going to ask you if you viewed the patient's HPI data or no. It was based, and this will come up about like asking if you verified medications. You can hit yes or no. It doesn't really matter, whatever. It's just verifying that you entered it. And then you'll see down here where staff who entered data are signed off, your name will be in here and the date you signed it. So that's how you know that that record has been signed off, is it will show up on this plan tab in the bottom. Now that this is complete, you can definitely print the record out too, and there's a you can see how that prints. So that is the overview, and all of this stuff that you've completed in the intake will always carry over into your next record. So when you add the progress note, you'll be able to see all this stuff and everything's going to carry over. So this is a lot of information, like I showed you in this, and it's a really just a lot of personal preference of how you want to put this in there and how you want to get information in there. But as long as you go through the tabs, it's fairly simple.